Hi, my name is Wendy Kim. I'm a Doctorate of Nurse Practitioner student at Touro University College, and I'll be talking about health policy education through social media. Four objectives that I'll be discussing through this presentation will be number one, the DNP prepared nurse's role in educating others about healthcare policy, including other healthcare disciplines and the general public. Number two, the evolution of social media over time and its effect on the healthcare system and healthcare policy. The role of technology in our current healthcare system and in the progression of global healthcare policy will be number three. And lastly, number four, I'll be just briefly discussing the overview of AB 890 policy in California. DNP graduates can serve as a leader in influencing and shaping healthcare policies and advocating for healthcare issues to other healthcare disciplines and the general public. In addition, DNP graduates can influence and shape policies that influence the practice of nursing. If you look at this diagram here, on the right, there is a difference between the doctorate and a nurse practitioner in who gets a master degree. Um, Basically, you have to finish your undergraduate program and get your bachelor degree and the master's program, and the terminal degree will be the DNP program, and you have to graduate successfully in order to obtain your doctorate of nursing practice. And in the doctorate of nursing practice program, you learn a lot about leadership, healthcare economics, healthcare systems, clinical issues in genetics, epidemiology, public policy initiatives, grant writing, and professional ethics. Evolution of social media. Social media is defined as forms of electronic through which users create online communities to share information, ideas, and personal messages, and other content, such as videos. The 2019 PEW Research Center report on social media used in the United States showed that 72% of the American adults use some form of social media. In 2005, the year after Facebook went alive, that number was only 5%. If you look at the table below, this table shows that social media impact is very great on healthcare industry. The 60% of the doctors feel that social media can enhance the quality of patient care. 66% of the doctors use social media for professional reasons. 31% of healthcare professionals make use of social media sites to perform social media networking, professional networking, I'm sorry. And 22% of parents seek medical answers through Facebook, while 20% of the people use YouTube. Healthcare industry in the US is becoming more transparent due to social media. 84% people using Facebook, 64% Twitter, 46% YouTube, and 12% blog. The social media effect on the healthcare system. Social media is attracting the attention of researchers, clinicians, healthcare organizations, and policymakers intrigued by its affordability, influence, and virtually universal reach. Policymakers in the healthcare context view social media as a viable tool to increase public's engagement to devise and implement policies to deliver public services that meet the needs of society. In the same light, the engagement of healthcare professionals in the process of policy developing is equally important and needs to be pursued by policymakers so that viable input from frontline nursing staff whose clinical, educational, and research expertise could add value to policy scope and direction. Social media hold a great potential in disseminating health-related information as they provide the public, patients, and health professionals with the platform to exchange on different health matters, potentially affecting population health outcomes. Furthermore, the use of media platforms as a real time learning resource will potentially provide actionable insights into patients' and caregivers' needs and preferences across the continuum of care. Finally, social media can promote awareness, health promotion, provide peer support, and extend access to health interventions, all of which bring a new dimension to healthcare. Despite its great potential, social media, when used carelessly, the danger this technologies pose to patients and healthcare professionals are formidable. Social media often can help bring people together. This is evident in the use of social media by both patients and healthcare providers. Um, Social media users are most likely to trust posts by doctors over any other groups. Um, Here's a look at whom users say they trust the most when it comes to posting health information. So if you look at this table, it says 60% doctors, 56% nurse, 55% hospitals, and you could read what is on what who else is on the list. Um, and what hospitals are doing, more than 1,500 hospitals with a social media presence. Facebook is the most popular, followed by uh, closely by Foursquare. On this slide, I'm going to be talking about some of the do's and don'ts of social media for healthcare. Do have a strategy in place, do create shareable content, and do serve as a resource to your patients and followers by listening and responding to questions. Do build relationships with patients via social media, and do analyze what type of content are resonating with your audience, and be authentic by creating a voice and personality for the organization. And some of the don'ts: don't disregard negative feedback from patients. Neglect will increase negative feelings. And don't violate privacy. HIPAA still applies. This is very important. And don't ignore the patients that are engaging. Don't take shortcuts by buying followers to build your community. And don't be overly promotional and simply touting your business isn't social. So, how do US healthcare organizations use social media? Here are some of the list, as you can see on this table: marketing, workforce recruitment, brand management, reputation management and customer relations, consumer, patient, and professional education, professional collaboration, community creation, wellness, population and patient monitoring, care management and care coordination, clinical trial recruitment, surveillance analysis, and product development. So, as you can see, the social media brings a lot of benefits to the healthcare organizations. However, the risk that's involved with using social media is that it could open door for negative comments. It can expose organizations to privacy, security, and ethics breaches. Staff may be inappropriately share confidential information about patients and the organization, and it could raise new ethical questions about patient and provider relationships. The role of technology in our current healthcare system and in the progression of global healthcare policy. Healthcare changes dramatically because of technological developments, and future technological innovation is going to keep transforming healthcare. Technology drives healthcare more than any other force, and in the future, it will continue to develop in dramatic ways. We need to be clear about the drivers so we can align with them and actively work to ensure the best outcomes for society as a whole. Advanced health technologies such as telehealth, chatbots, VR, and AI could be utilized to reduce the burden of both communicable and non communicable disease, as well as to build patient centered decision making healthcare system. Understanding the various methods of enhancing healthcare services using advanced health technology will help to develop new applications that can be integrated into regular healthcare. Although the social media have been increased very rapidly, especially in California, the full practice authority has been very delayed or behind compared to other states within U.S. And I want to just briefly talk about the need for AB 890 policy, um, as that's the newest policy for the nurse practitioners in California. Just to give you a little background, California healthcare system is facing a crisis with rising costs and millions struggling to access the care that they need. There is a need to remove the supervisory requirement as MPs can provide the same high quality care directly for patients. MPs need to practice to the full extent of their education and training. It will allow direct access to healthcare for millions of Californians who now have coverage but often struggle to find healthcare providers. The MPs are a viable resource for the state legislators in considering new policies. The implementation of AB 90 holds great promise for the state to expand access to high quality care. AB 890 policy has two new categories, and it's referred to as 103 MPs and 104 MPs. The new categories have additional authority to work without standardized procedures. 103 MP, this MP works in a group setting with at least one physician and surgeon within the population focus of their national certification. And 104 MP may work independently with the population focus of their national certification. The new 103 nurse practitioner application is now available in Breeze website through Board of Registered Nursing website now, and the law requires an MP to first work as a 103 MP in good standing for at least 3 years prior to becoming a 104 MP. Therefore, the application to become a 104 MP will not be available until 2026. The MPs need to advocate for the AB 890 policy as it directly impacts on patients and nurses. MPs, clinic and healthcare system leaders, policymakers, safety net providers, and communities must be proactive in shaping attitudes and policies that impact their practice. It will take time to educate stakeholders and evaluate how this policy is put into action to determine whether the policy is working. To accomplish this, MPs will need to be um, active in involvement of supportive physicians, other healthcare leaders, and policymakers to attest to the safety and quality of MP practice. They will also need the advocacy of their patients, sharing experience of care with families and friends in the community. The more people understand the unique contributions of MPs, the easier it will be for MP practice to flourish in California. With a brief overview of AB 890 policy, it is my big desire for you to become a supporter of AB 890. And before I end this presentation, I would like to read you a quotation that I got from the textbook, and it's by author Porsche, DJ Porsche. Some ways in which nurse leaders can affect public health policy is to become advocates for change, conduct high quality research in this area, and facilitate quality improvement projects focused on health policy change. So, thank you for listening. And And the next page will be the references. And please reach out to me if you have any questions. Thank you very much.